Jim stayed home from work one day. It was, I think, the 19th of November. And I went on to work, and I checked with him during the day, and he was still not feeling well. He just wasn't feeling good. Like his stomach just wasn't right. He went and tried to lay down for a while, and when he got up, it was a little after 4, I believe, he just says, I think you're going to need to take me to the doctor, and I knew at that point it was too late to get him into his doctor, so I said, well, I'll take you to the walk-in clinic.
I knew something was wrong. I mean, I hadn't been feeling good for, really, it had been, maybe a month, just kind of going downhill, so I don't know, if that was part of it or what, but that last couple days there, that's when it got bad. I really wasn't in a lot of pain. I was just irritable. I couldn't get comfortable.
All of a sudden, I heard him fall in the bathroom, and he had passed out. I couldn't get him to come to, so I called 911, and I still can't get him to come to. And then when I was on the phone with them, he did come to a little bit, so I was able to get him to lay down, and he was talking a little bit, but in and out of it. When the ambulance got there, his vitals were fine, his blood pressure was fine, and he ended up walking to the gurney because our house is small, and then they took him on to the hospital and wasn't really in a hurry because his vitals was fine and he was awake. He was kidding around like he normally does. When we got to the hospital, they started doing blood tests right away and asking us some questions and everything, and it just seems like one test led into another, and then it was getting to now they were looking for a blood clot, and that came back positive. So then that's when they ordered the CAT scan. Dr. Baghelai, she read the CAT scan and immediately called her husband because she said he wasn't in too good of shape and she needed her husband to get back to the hospital soon. So, just that little bit of time of her calling him, saved a few minutes, and it's just amazing how the Lord worked that night to have everybody in place that needed to be there. She did call the doctor, Dr. Trigger in ER, and he came in and he was just told us what it was. And it's I had never heard of that, an aorta dissection. I didn't know what that was. And here we thought he came in for a virus, just feigning, and then the next thing we know, he's going in for open heart surgery. It took a good 8 hours for surgery, and they kept calling me every 2 hours in the surgery waiting area, saying that he's okay. That was all they said. He's okay. And that they were still working on him and stuff. Dr. Baghelai came out and told us that he had made it through it, but he still had hurdles to go through, And then they took him up to CCU, and, from then on it was just, a real good recovery. It's just from everybody that took care of him is totally, it's just amazing.
Well, recovery went really well. Everybody did a great job in the ICU, and of course when I got moved to the room, they just treated me so well. I was very happy about that.
Even in the emergency room, when he was so ill, and I didn't know what was going on, and I didn't really know anything about it. Everybody was so, informative, and they just reassuring, and, this is what's going to happen, and it did.
I really never went through any pain, after the surgery, and even when I went home, I never had any pain other than when I coughed, but I think they did a very good job.
I'm just so thankful for Lakeland to have saved him, and just the teamwork that was there. Everybody in the emergency room that met us there at the beginning through all his care, nutrition, EVS, everybody treated us like we were a family member. There's a lot of good people that bring their hearts every day. We're just thankful and the miracle that worked that night, because it truly was a miracle. Mm-hmm.